there was something called nitrogen mustard. That was the only chemo available that time. In medical oncology, from a single agent now, for every cancer, the chemotherapy is different. That it is driven by what stage? It is driven by the intent. Either it is a curative intent or palliative intent. Being in India, we should be proud. Not everybody wants to explore the onco field. Not many medical people itself want to know about oncology. But oncology has evolved a lot. Being in India, we have the luxury actually, where in abroad, you have to wait for months to get an appointment for many things. Here, you have the luxury to just go to the doctor and get it diagnosed.
Dr. Yasmin, hi, we are back again.
Yes.
So, firstly, doctor, I want to understand why are you practicing in Tamil Nadu? Why did you choose to practice in Tamil Nadu?
Okay, Rashmi, how post MBBS, okay, so as I told, I had this, always wanted to be in oncology, okay. So post MBBS, of course, for my PG preparation, I came to Tamil Nadu. Then I took my PG here again. Now, thing is, Tamil Nadu is the land of empowerment. I feel really empowered here, okay, because the medical facilities, and everything is so, well balanced kind of. And I think onco is at par also here, coming to onco setup. And you have the best, cancer, one of the best cancer hospitals here, not only to practice, but also to, train, to study. So my journey started with Adyar Cancer Institute, which is one of the pioneer in cancer care in all India, with Dr. Shanta, our mentor, and our advisor, Dr. Krishnamurthy, leading the way for cancer treatment in all over India, followed by some legend. That institute has, created some legends. My late HOD, Dr. Selvalakshmi Ganesh Raja, who is unfortunately not among us. I have seen many people who have inspired me, and there are many people who are silently working. They are not all heroes wear caps, right? And those are some. Then, see, there are many challenges in cancer treatment. First of all, convincing the patient for the treatment, making them accepting the treatment is also one issue. But I think because back here in South, education level also, the literature levels kind of help the patients to understand the facts. So we don't have to, convince them so much of our time. And secondly, patients complies to what we say. Yeah, that is a very good thing. And thirdly, once out of Cancer Institute, again, I'm in Apollo. So again, Apollo also makes me feel very empowered, because what is the challenge a doctor faces is in cancer patient is, apart from convincing or breaking the bad news to patient about the diagnosis, is the art of minimizing the duration between diagnosis to treatment, which I feel is very much possible right now where I am. So again, my journey is very back and forth to Assam and Tamil Nadu. I keep going to Assam also. So what challenges I face there is, many a time to start the treatment, it takes lots of time.
Doctor, do you feel that working in Tamil Nadu has given you the power to take this kind of knowledge back and contribute to the treatment in Assam?
No, yes. See, me as a person, I evolved in Tamil Nadu also. This place has shaped me as who I am, and that's why I can give back to my state, my parent state. And I'm a very proud Assamese. I always feel proud of being an Assamese, but at the same time, I am very proud of the fact that as now I chose Tamil Nadu as my, workplace. This place is full of many diligent mind, both, and the work culture is great. The people are, very accepting. Once you know the language, you are like a Tamilian itself. You don't have to prove yourself. And again, I have been inspired by many people in Cancer Institute, and there are many people there right now, my seniors and all who are working in Cancer Institute, they're giving their 100%. Now then, after that, coming into Apollo, again, by God's grace or what, I have met some excellent people, like, brilliant minds in Apollo. And right now, that same person is my HOD, with whom I am working as a team, Dr. P. Mahadev. He is one excellent radiation oncologist and a brilliant oncologist. For me, I'm a student. Still now I feel I'm a student. And for a doctor, for your whole life you have to be a student, because medical field keeps on evolving. Okay, everything changes once now and then. And then my colleague right now, with whom I'm working, we are 3 people practicing together, me, Dr. Mahadev, and Dr. Lokesh. So we are trying best in whatever we can to make the changes again in this field in radiation and provide the patient whatever best.
Doctor, you're saying that as a doctor, you have to remain a patient always, and there's always a new evolution happening in the field of medicine. Can you tell me, in the field of cancer, what are the advancements that have happened over the last decade, and what are the things which have made recovery easier for a patient?
See Rashmi, I'll tell you, okay? From every field I'll tell you. Now the cancer treatment per se is not only, it's a multimodality treatment, okay? So cancer oncology per se has three branches, right? So your surgery, your radiation and your chemo. Now the radiation and surgery are something of more localized treatment, and chemotherapy is systemic treatment that works over the body, okay? Now over the years I'll tell you the journey of onco, okay? First, initially, of course, initial days, those, let's say 100 years from now, okay? 100 years back, if you see, they used to do surgery. Chemo per se, there was chemo evolved as a single agent. There was something called nitrogen mustard. That was the only chemo available that time. Then radiation also, they had something called initially called grains ray, like, then only it came from grains to superficial, then ortho voltage, then to cobalt. From 50 years from now, we used to have cobalt machine, and Cancer Institute here in India had the one of the cobalt machines here. So it has evolved, okay? So from that cobalt time, in radiation, I'm saying, we are living in what? We are having X-rays. We are living in the generation of X-rays and protons, okay? Now for X-rays also, of radiation, we have so many different technologies and techniques to to deliver it. We have robotic machines also to deliver radiation now. And when coming to chemo where it started with nitrogen mustard, again a medical oncologist will have a better knowledge on me. But then what I know, because all of us will have idea of all the fields. So in medical oncology, from a single agent now, for every cancer, the chemotherapy is different. Again, I told in the first itself that it is driven by what stage? It is driven by the intent. Either it is a curative intent or palliative intent. It is again with the histology and with nowadays molecular factors, and even they see the genetic panels. Okay, and with that we are living in an era of targeted therapies, high precision, and we have immunotherapy also developed over the years. Okay, then in surgery also, nowadays the surgeries are more advanced. People have started doing surgeries with robotic machines, right? And we are living in an era of cancer treatment where we are able to do organ preservation.
This robotic surgery is available in India, doctor, or is it's available in West?
No, it's available here. It is pretty much available in everywhere. In Apollo, we have robotic surgery.
It's so advanced in India.
Yes.
Cancer treatment.
Being in India, we should be proud, and we don't know, that's why, because not everybody wants to explore the onco field. Not many medical people itself want to know about onco field. But oncology has evolved a lot. Being in India, we have the luxury actually, wherein abroad, you have to wait for months to get an appointment for many things. Here you have the luxury to just go to the doctor and get it diagnosed.
This is something I completely agree with. I mean, a family friend just had a fall and had multiple ligament tears, and he couldn't get an appointment for over 3 to 4 weeks, and misaligned ligaments were healing by itself in the wrong alignment, which is so bad, right? And he had to come back to India to fix it because he was not getting an appointment.
That happens. Yet we don't appreciate our medical system actually. If we know to properly utilize, India is, for me, this is a place to get treated. At least for oncology, working in both setup, I come from a setup which has, pioneered the oncology setup in entire India with the guidance of Dr. Shanta and Dr. Krishnamurthy. Then I am in a corporate setup which was the pioneer in starting a corporate setup cancer care. So, of course, there is some difference, but the best thing I feel is you have the luxury to come and get diagnosed and start the treatment at the
And
earliest.
doctor, I remember before starting the podcast, you were talking about, the shorter the duration of a treatment, what is the impact of that on a patient?
Okay, Rashmi. So what happens, no? Every treatment, okay, of cancer has a duration. If you give chemo also, it has cycles. And we have radiation. Radiation also have a duration. So radiation can be delivered nowadays with more advancement of radiation and the facilities. We are doing radiation, either hypofractionation, where we can give the radiation dose adjusted in a small period of time. And then we have something called SRS and SRT, that is called stereotactic radiosurgery or therapy, where we can give high dose of radiation in some areas which are not feasible for surgery with radiation itself, with robotic machine like cyberknife, or you can do it with a normal radiation machine also we have. Now the thing is, everything have a duration. So initially when we are doing the treatment, no, there is a setup time. Let's say I'm talking about cervical cancer. Cervical cancer is one of the most common cancers in India, and we as Indians, we contribute to the global population of cervical cancers also.
Really?
Yes, cervical cancer is the second most common after breast in females, and it is something very common among the lower socioeconomic class. And most, whereas you see breast in the urban population, cervix is something you see in the rural population. Now let's say, so for CA cervix, no, we have a time, okay, radiation. For those with locally advanced, we treat with radiation and chemo. Now there is a time. Studies have shown that whenever, like when the radiation is done, then there is something called even internal radiation also. There's a gap of, like, there's a period of overall treatment time, OTT, should be of 11 weeks. Now it goes beyond, your success rate or cure rate comes down.
Why is it?
Now the interesting fact, okay. See, when radiation is exposed to the body, no, two things happen, right? Cell death happens or cell injury happens. Now those cells who dies, they dies. Now those cells who get injured, okay, and there is a gap in the radiation, one day regenerate again and they'll repopulate, no?
Yes, and that is why I guess that in the middle of the treatment, if you keep on
Taking
doctor
breaks.
shopping,
Yes.
or even this concept of delaying and
Yes.
procrastination, oh my god, that's like,
Correct, no? That you understood, no?
Yeah.
It will happen like that, right? So
you should not allow your
either
injured cell
if
to
yes,
recover.
once you start the treatment, no, you shouldn't make a habit of taking breaks. So that happens in radiation. So in again in chemo also, some chemos are 2 weekly, some chemos are 3 weekly, right? Now if this chemos also, you take a break, okay, yeah, yes, there.
Doctor, chemo and radiation are two different things.
Yeah, chemo is okay. Now, chemotherapy is nothing but the medicines you use for cancer treatment. This can be your tablet form, this can be in your IV forms. What is most commonly used? It can be available in tablets also, it is available in IV forms also. So, basically, when we use the word chemo, no, we get very skeptical, we get very scared. This is just medicine, because many people in the OP, they will ask, ma'am, instead of chemo or radiation, something medicine can be given. Well, the medicine itself is chemotherapy.
And you said about cervix, India being a global contributor, largest contributor to global cervix cases, cancer cases, and rural segment seems to be contributing higher. Is there any factual reason as to why that is the case?
See, CA cervix per se, is the cause, the 100% cause of CA cervix is virus. Now, I told you, there are identifiable causes of cancer, being tobacco being first one, then your obesity, inactive lifestyle, and other than that, viruses also has a contributory factor. Now there are some cancers which is caused by viruses, like your cervical cancer, which is by your HPV, human papilloma viruses. Now can you believe, even the nasopharynx in our side, it's very common, northeastern part, the nasopharyngeal cancer is very common. Now that is attributed by a virus called EBV, Epstein-Barr virus. Now can you believe, your liver cancer, HCC, also can happen due to what virus? You will know it very commonly. You are taking the vaccine also.
Corona?
No, hepatitis B.
Oh.
So since we know this are caused by what? Viruses, right? So hepatitis B also can lead to liver cancer.
So you can take So, are there vaccines, doctor, for
Yeah,
cancer?
that's why.
There's vaccine for cancer.
Yes, we have vaccine for cancer for like viruses. Since what is vaccine? Vaccine is what we are giving. We are giving in active form of this one in your body, the small dose of those viruses antigen, so that your body gets immune to it, right? So like that we have, since it's a bonus for us, since those are viruses and we know about them, we develop, there are vaccines available. So your hepatitis B vaccine which you take, no, at 3 shots you take, no, that itself is protective even if like your hepatocellular cancer. Then your cervical cases, cancer, it can be prevented with vaccines. There are available vaccines which you can start at the age of as early 11 to 12 years old in females. Now there are some trials, future trials like Patricia trials, where they are using even human papilloma, cervical vaccine for treating early cervical lesion, like pre-malignant lesions are there, no, even to treat that also. So, and let me tell you, don't get surprised, there are 200 stains of human papilloma virus.
So, pap smear will give us that input. Is
No,
it
pap
pap smear?
smear. Okay, see, let me tell you step by step. So what happen is human papilloma virus has 200 stains. Okay, out of which 9 stains are there which has connection with cancers. There is something called 1618 which causes your cervical cancer. Then 611, 1618. Okay, these 4 stains are connected with not only cervical cancer, even some esophageal cancer, male genital cancer, female genital cancers, and all. Then other than that, I think another 5 are there. 31, 33, 45, 52, and other I forgot, like that. Okay. So since this, for two stains, no, they have like vaccines. Like there is one called Cervarix, that is for only 2 stains, 16 and 18, which can be again introduced for cervical cancer because it is well established. Then 4 stains are there, 6, 11, 16, 18. For that there is another vaccine called Gardasil quadrivalent, that is 4. Then another 9 another stains, there is another vaccine called Gardasil nanovalent, I think that is the brand name. Now these are all foreign, you have to import it, no. Our country, we have our own vaccine, that is called Servavac, that is a quadrivalent, that covers 4 strains, 6, 11, 16, 18 strain. That itself will give you prevention against cervical cancer.
Doctor, I'm 41 years old. I've gone to my gynecologist and seen that poster. I've never taken any vaccines. Do you think it
Actually,
is?
it is ideal to take before the age of 26, but if you take after the age of 26 also, yes, there will be benefit always. Till 26 to 45 also you can take, but the ideal will be from 11 to 12, start at the age of 11 to 12 and till 26. Now only difference will be in 11 and 12 till 15 you can have 2 doses. Beyond that you have to take 3 doses. But it's an ideal because
And doctor, can you tell me like how would you do a hand holding or what would you advise somebody who wants to do screening for cancer?
in this time where we are living, we have many luxuries. Okay, the screening is one among them. In old times, maybe our ancestors would have suffered from cancer, but they don't know. And as I told earlier, cancer is curable when detected early. So, especially in cervical cancer, no, I'm telling, with screening, you can do a simple screening after the age of 21, okay, till the age of 50 to 60, a pap smear every 3 years. Now, what a pap smear will tell you? It will help you to diagnosis, to catch the pre-malignancy form, okay, because there is something called pre-malignancy, that is before the formation of cancer, the stages, what the cell.
But is pap smear useful after menopause?
Yes, definitely. And every 3 years you can do a pap smear. And once you till 50 years of age, if you have two negative pap smear, you can stop, or you can go till 60 years old age also. Now same comes with your breast cancer. Now breast cancer, if you are someone with a hereditary, unfortunately, you have hereditary connection, you had family history, you can start with a mammogram. Okay, you can start as early as possible you want, or you can start the age 10 years before your family, whoever your family member had breast cancer. Let's say I had an aunt, example, at the age of 35. I can start as early as in my 20s to do a breast screening. Now the breast screening is you can do at the luxury of your own home. Okay, you can do a self breast examination. You can do that at your home. Or if you are not comfortable, you are not able to diagnose or find out something, or you have something suspicious, you can do that same at the help of a clinician with a clinical breast examination. Now some females, nowadays so many things are, so many people have, some benign breast lesion or something. So for that also you can be under follow up. You can either do a ultrasound or you can do a mammogram. Now there is a small glitch here. Now it's always, if you are someone less than the age of 40, you better to go for an ultrasound, because you'll be having a dense breast. If in ultrasound you find out something, then you can go for a mammogram. And if you are someone above 40, it's always better to go for a mammogram. Like that, for other cancers, for lung cancers also, you can go for screening. There are many criteria which tells you can do a CT scan, or you can be a follow up with the screening you can do under a clinician. And then one thing which is silently rising is prostate cancer among elderlies. If you have an elderly at your home, who will be waking up many a time, going frequent urination and all, for them also you can do a serum PSA levels as a part of your screening. You can just do the test, so that if a high level of prostate antigens are there, PSA, you can get it diagnosed.
Can a normal person who's having a healthy lifestyle voluntarily go and ask a doctor that I want to do cancer screening for myself in every type of cancer?
Yeah, see, there are some cancers, especially this prostate cancer I'm telling, most of the patients who comes to us are the one who are getting diagnosed at master health checkup. Females nowadays like to do self-care, right? Self-pampers, like your beautiful nails. So like that we can have a, regimen, for ourselves. Taking care of our health is also a part of our self-care. To show us way of self-love, I feel.
Doctor, if somebody wants to reach out to you and just for a conversation, how can somebody reach you?
Right now I'm associated with Apollo Cancer Center. They can always approach me there, and I'll give you the not my contact number, but I'll give you my Insta and Facebook handles.
I'll put it in the description.
Yeah, see, I want to tell one thing, Rashmi. See, the way the main motto behind this podcast and this beautiful discussion we had is not people should reach me. If someone feels I could be of any help to them, I'll be really looking forward. But the main aim should be, if you are suffering from cancer, or if you feel you may have cancer, to reach out to accept it, that it might happen. Because one thing very common in our society is people thinks if we go to a cancer doctor, even though it's not cancer, they will treat us for cancer, which is very wrong. And that's why we do biopsy and everything. Okay, why we do biopsy? Because we want to establish that it's cancer or not. Even though you have a tumor anywhere in the body, until it's in a position where biopsy is not possible, okay, we'll do the diagnosis radiologically based on the imaging. But other than that, for everything we are doing imaging, we're biopsy, right? Why we are doing the biopsy? Because we want to establish. Because giving a patient the first and foremost, criteria to initiate a cancer treatment is to establish the diagnosis. That is the biopsy. So, my request to all the viewers, whoever reaches to this podcast, is first you should know where to go, whom to approach, and not to delay. Because from the time to diagnosis to time to initiate of treatment, I told, that matters a lot. And another thing I want to tell is, this is very important, I forgot to mention. Whenever, if at all, some of you are going through treatment, please, until there is some problem which has a medical problem which has arisen and your doctor is unable to further take the chemotherapy or radiation or treatment forward, please don't default treatment. I have seen patients who are feeling better after some time, but then they had a talk with some other patient or some attender, and they tell something and this doesn't correlate with you, and you are cross-checking again your diagnosis and your treatment. And like that, many people have defaulted treatment. Not everybody, but there is some subset of patient who does that, which I would request not to do, because cancer treatment is moving towards personalized treatment nowadays. No, every patient set of treatment module and modality is different. Okay, so some patient with head and neck cancer may have radiation for 6 weeks. At the same time, some patient for breast cancer it is 15 days only. For cervical cancer it is totally different. So I've seen patients who doing that. One patient have something, another patient is taking treatment somewhere, and one patient told, no, I think your treatment is wrong, and they defaulted. That happened actually. I'm telling you.
Because they think cancer is just cancer. They don't understand that everything is unique.
Every human is individual. No, we have all individual personalities. Like that, cancer diagnosis also has its own identity. Like if you take in that form.
Guys, if you're watching us today, I would like to request you that I see that 80% of the viewers for my podcast have not yet subscribed to my channel. Please subscribe to my channel. Your support helps me bring new guests into this podcast, and it helps more and more people watch it. People like Dr. Yasmin can create more awareness on very important topics that impact everybody, maybe our friends and family also. So and I will be sharing more credentials about Dr. Yasmin in this in the description of the episodes that I'll be we spoke about. So please subscribe and please follow me and help me grow and help me create more awareness about various topics on health.
So I request everyone to please subscribe to Rashmi, because she's doing great jobs. And not everyone would like to do this for people. There are many people who will create, just to garner, some views or not. But Rashmi is really working on ground levels. And on this very podcast, I've been working since a week or more. So please subscribe, and especially to people who know me personally from Tamil Nadu or all over Assam, please subscribe to Rashmi. It will benefit everybody. Thank you so much.
Thank you, doctor. Thank you for your support. Thanks,
you.
guys.